Everyone, and thank you for that lovely shout out, Senator Woodard. I'm glad that that got to you in time. And hopefully there's plenty of people across the state who are going to be wearing those masks in coming weeks. And hopefully we won't have to wear them for that much longer. Anyway, I want to thank you all for inviting me to moderate this panel again this year. It's always a tremendous opportunity to hear from our legislators here in the state. And I have just a couple of housekeeping things. I've been seeing a lot of chatter on the chat. As a matter of fact, some folks have asked about how they can share resources, and you can share them in the chat. And then at the bottom of the page, at the bottom of the chat box, you can do, there's a little box with 3 little dots in it. And if you click on that, it will say save chat, and you can save the chat with all those resources in there. So keep that in mind. That's a way for you to have a way to save all of the great suggestions and comments that are being made. For the purpose of this session, I'm going to ask folks to, if you have a question during the panel, I'm going to ask you to drop them into the Q&A, which you can see at the bottom of your Zoom screen. You'll see a little thing that looks like little talking bubbles, and it says Q&A. You can put your Q's and A's there. And I'm just being told that attendees don't have the option to save the chat, but I know that the organizers will save the chat, and they'll be able to share all those resources with you. But if you can leave your questions in the Q&A. We also have questions that came in with the registrations, and we've organized them. We have a lot of questions. We're going to try and get through them, and you're going to see me having legislators kind of be terse. I'm going to ask for them to be terse. So without any further ado, here's my watch. I'm going to be timing them, and I'm going to introduce our legislative panel in alphabetical order. So first up is Senator Jim Bergen. He represents District 12, which is Harnett, Johnston, and Lee counties. And welcome, Senator Bergen.
Thank you. Nice to be here.
And next up is our honoree. Hopefully she's managed to put herself back together. Representative Carla Cunningham, who represents District 106, which is Mecklenburg County. And congratulations, Representative Cunningham.
Thank you. Glad to be here this morning. Thank you so much.
And the next person up is, who will be joining us, is Representative Pat Hurley. She represents District 70 in Randolph County.
Yes, thank you for having me.
And
I've been here times.
I know you've been here quite a number of times, and I'm always amazed that you drive all the way to Chapel Hill. It's a good hour-long drive, so I'm sure that today is a lot easier.
It's better. Thank you.
And then also someone who's more local to the legislative breakfast is Representative Marcia Morey. She represents District 30 in Durham County.
Morning. Great to be here. Thanks.
And then finally, we have Representative Robert Reeves, and he represents District 54, which is Chatham and Durham counties. So welcome, Representative Reeves.
Thank you. Glad to be here.
So when we practiced earlier this week, the representatives and the senators, they'll be raising their hand when they want to weigh in, but I'm going to ask questions and we'll have a whole discussion. And, part of me is tempted to just, here it is, it's coming in on the Q&A. So I think I'm just going to start off with asking about, we've heard about access to care. We've heard about the ability for people to receive care if they can get to care. And the question of Medicaid expansion has come up year after year. We've been asking it for 6 years now. It's a critical access issue for many people to have Medicaid. The pandemic has resulted in probably 200 to 200, maybe 300,000 people in the state losing their employer-sponsored health insurance. So the question is, what is the plan for Medicaid expansion this year? Do you think we could see it? Is there a way to find some compromise between the two camps on this? And I'll let folks weigh in. Who'd like to start on this one? I know it's always a tough one. Let's get it out of the way. It's a really important question. So maybe I'll call on someone. So Representative Reeves, I know that you're in the leadership in the House on the Democratic side. What are your thoughts about Medicaid expansion this year?
Well, thank you, Rose. I would just say that I probably would join with everybody else on the panel. And yeah, the bottom line is that decision is going to be made by the majority at this point. I don't think there's any confusion about positions on Medicaid expansion. What I would say is I want to see the most people in North Carolina get insured in the most effective and efficient way possible. And whatever it takes to get there, I'm all ready to go. And I think I can speak for a lot of people, at least in that House Democratic caucus, and say the same thing. Just tell us what we've got to do. Let's get these folks insured. Let's get people's premiums down. Let's get hospitals saved, and let's get to work.
Senator Bergen, I know that I see that Representative Hurley has her hand up. And I also know that you folks participated in the governor's task force around healthcare access. Representative Hurley, what are your thoughts on this year?
Well, when we first became the majority, we were $2 billion in debt because of Medicaid. And we do not want the state to get into debt again, because we are the number one economic state, I think, within the top 5, because we have used our money wisely. And there will be a payday. They keep saying there's no state money involved. Well, there will be. The federal government, which is taxpayer dollars, and they do have the authority to print money. We do not, and we do not want to bankrupt North Carolina, because right now we have at least 2 million people on Medicaid, and they want to add more. We do not want to put our right now we are really good at spending the money, and children get on Medicaid regardless. And a lot of people, there's an awful lot of fraud in Medicaid. If we could stop that, we'd probably have enough money to pay for everybody. But somebody's looking for ways to get by without paying. But the fraud is very, very high. And I don't think that we will expand Medicaid this year. I think we don't know how much money we're going to have yet. So we are going to see, and 58% of our budget goes to education. And so there's 20% left, and 20% normally goes for health and human services, which is we need more. But I don't think that we will expand Medicaid this year. There may be some legislation to address certain parts of it, but I don't think we will go totally to expanding Medicaid.
That is one of the questions that's come in through the Q&A window, which is, you say that there are some things to get some care to more people. Are you able to expand on some of those?
Well, to have some of the nurses and the practitioners and the psychiatrists to be able to do extra and telehealth and telemedicine, I'm hoping that those things will be done. We shall see. I don't know. We're just getting started. And starting to, all the bills that were there last year are gone. This is a new year, and whatever was there, if they want to run them again, they can run them again, or we can all run them again. But we have just begun, and it remains to be seen what will come up and how much money we will have to spend. I'm on education appropriations and not health appropriations, but I do have a heart. I have a heart for this, because I know that was the number one thing when I came in 2007, and the children, I didn't realize that the children were still not being taken care of and not being cared for. And I guess they're still going out of state. We do have 2 new places in North Carolina now for children. Guilford and Harnett County, I think, have of a place. But there's a lot of work to be done, and I certainly want to help.
Representative Cunningham, you have your hand up.
Thank you. I was hoping I was going to yield to Senator Bergen to hear his thoughts.
Be happy to.
Since we both serve on the governor's committee.
Yeah, I'd be happy to talk about it. And I'm serving as one of the healthcare chairs this year. And it's a priority for me and our caucus to get healthcare to folks. And I think you're going to see a lot of good things. This pandemic has really changed things and made things, I think, become easier to do. You know, who would have thought that we would have jumped into telehealth and that we would have started doing a lot of the things, scope of practice. You know, the governor relaxed a lot of the issues on access to care. We want those things to continue. When you talk about the SAVE Act and you talk about all of these other things that we're going to be looking at. I mean, I'm working on bills right now that are going to target areas. I think that we need to extend the amount of time that new mothers can stay on Medicaid. I think that needs to go to at least 6 months or a year. We want to target the families and the individuals that are the most at risk and help them. But Medicaid doesn't need to be a healthcare system that's a way of life. I wish we had a system and we would put a time limit on it that you could stay on it. Then we could actually address more people and help more people. In last year's budget, we had 1,000 new innovation waivers. Those didn't get pushed out. I want to do that. I want to get those folks off of that. We've got over 12,000 people on a waiting list right now, and I want to deal with that. And I think there's a way to get those folks some care. Maybe we don't do a full waiver. Maybe we do a partial waiver. So I want to look at that. But we've got to back up and start with children at conception. We have to change our lifestyle. We have to change. I mean, we are so prosperous in this state that it's kind of become a big problem for us. Obesity is a big problem in this state. Hypertension is a big problem in this state. Heart disease is a big problem in this state. And all of those run up costs and make it hard to deal with a lot of the other things. So I've been talking to a lot of you about a program that I want to do called One Generation, that we start with conception, follow folks through, and in one generation, change healthcare and health in North Carolina. So I'm excited. I want to thank everybody for letting us even be here today. And thank you for not canceling this event. I thoroughly enjoyed the last time being with my friend, Representative Cunningham. It's always good to be with Mike Woodard. He's just a good friend. Jenny, thank you. Max, Cody and I talk all the time. And you know, a lot of us are working together to get things done. And even though a lot of people think that there's a lot of battle and bickering and stuff, most of us are really good friends and we want to do good things. Let me back up. We want to do great things for North Carolina and healthcare, and I'm committed to do it. And mental health is my passion. We are going to do big things on mental health, and I promise that I'm going to work on it.
Okay, Representative Cunningham, but before we do, I'm going to limit folks to 90 seconds and I'm going to start saying, I'm going to start interrupting you. So, and I've got a little timer here that I'm just hitting folks. So Representative Cunningham.
Okay, thank you, Rose. I hate I got the time limit, but I really did want to hear the views from Senator Bergen and Representative Hurley. Right now, what we do know about the Medicaid expansion is that over 200 and something thousand people lost their jobs. And when they lost their jobs, they lost their insurance coverage. That includes their children. The second thing we know about the Medicaid expansion is that it will cost more for us to do a carve out. It would be like 65% return instead of a 95% return. So a plain Medicaid expansion is better for North Carolina and for the cost of it. The other thing on the innovation waiver slots, that's a tough one. We do have that 13,000 individuals in the state of North Carolina that have been waiting in sometimes 7 to 10 years to get the care for their adult children who are IDD or mental health or dual diagnosed, as you say. So we have to move forward. We also had 2 hospitals in the state of North Carolina that ran behavioral health facilities and no longer do that as of last year. So we had a mental health crisis prior to COVID. And the expectation is that we will see a significant uptick in the need for those services once COVID settles and return to some type of normalcy. So Medicaid expansion is very important. It's a matter of how we do it. And I think we're working on that. I think we need to keep talking about it and find a medium so that we can get it done and cover that 600,000 people in the state of North Carolina, because I've been one of those people. And if you've had that up close experience, you understand.
You did a great job, Representative Cunningham. That was 92 seconds. Thank you so much. You managed to squeeze a lot into that short amount of time. There's a lot of chatter on the Q&A panel here, and one of the things is that I've seen this in my own research, that Medicaid expansion tended to save states money because you have fewer people using emergency services, showing up at the emergency room. In particular, it tends to save money in the mental health space. How, is that perhaps a place where folks could find some agreement on moving forward? Representative Reeves, you have your hand up.
Yes, and I really wanted, if Representative Moore wanted to go, I want to give her an opportunity to go because she hasn't had a chance to speak, but I did have some points I wanted to bring up that I think would be helpful in the discussion. Did you want to go, Representative Moore? Okay, all right, well, what I wanted to do is I think sometimes one of the things I want to clarify for a lot of people out here, because you've got an amazing event, an amazing number of people listening, and I know sometimes that you're dependent on us for information. And so one of the things I wanted to point out, and Representative Maury and I have a particular viewpoint on certain parts of legislation because both of us work along the criminal justice system. And I think that Representative Maury and I can agree, especially, there's no such thing as a system that people use money that's not going to have fraud, none. So if we operate on the position that we can't operate a system because of the potential for fraud, you literally shut down the government's ability to give money. I've seen companies that are multi-billion-dollar companies that still defraud the government whenever they get government contracts. I've seen the best people in the world with the most resources in the world still defraud people when they get a chance to have that. What I want to clarify is, especially what you said, Rose, mental health is the biggest place where Medicaid does us a service. Because almost by definition, folks that have severe mental health issues don't have access to the care that they need. And it becomes a revolving door. They're going to get some service, whether it be through the jail system, the justice system, the emergency rooms, or wherever. It will save us money, in my opinion, to give them that service on the front end to try to help them control and help situations that they have, instead of continuing to be people that present on the back end. So I would just say that I want to make sure that was clear to people that most folk that I know that need Medicaid don't want to be in that position in life. Most of them. I can't imagine somebody who's sitting around waking up one day and saying, I've got a couple of things I can do today. I could be in a better political or economic situation, or I could stay on Medicaid. Most would like to be in a situation where they can get health insurance, but we just don't have it available for everybody, because for all of us that are having great successes in life, there are people on the other side that just can't make it for reasons that have nothing to do with who they are. So thank you.
Representative Reeves, okay. So one of the, I think one of the places that we can agree that everyone, or Representative Maury, do you want to weigh in, or should we move on to kind of the next question? Okay, so go ahead.
No, let's move on. I know we have a lot of questions. Everything's been well said.
Well, one of the places that we all can agree, and one of the largest groups in Medicaid right now is our children, and their children's mental health services are in North Carolina are ranked near, at or near the bottom for all 50 states. What's your understanding as to why this is, and what can the legislature do to help remedy this lack of services for children and adolescents? And anyone want to give that a try? Representative Hurley, thanks for being so game. I really appreciate it.
Well, I do know that we don't have enough psychiatrists and doctors and nurses, enough people to take care of all the children and everyone who's having this. So we do need to look at trying to recruit more into North Carolina, and we do need to try to see what we can do. And I worry about the children in the beginning, the responsibilities that they're being taught, and it does begin in the home. We need to try to be sure that the children are getting the care and the nutrition and everything that they need. And we do early childhood care. And this is a big part of it. We don't know the environment that they're in. And we do know about the suicides that are horrible. I know Representative Cunningham has worked on this so much. And children just cannot take defeat. We need to let them take responsibility. We need to teach them responsibility in the beginning. And I'll be working any way I can with Carla and others to try to help, and Senator Bergen, to try to help to do what we can to help. I just don't want to bankrupt North Carolina. The money is not there. The federal government is dead in trillions. Our grandchildren and great-grandchildren are going to be responsible for this forever. And we just need to be careful with what we do with our people. I mean, taxpayer dollars. We just need to not bankrupt everybody. Thank you.
Representative Maury, I see that you have your hand up.
Yeah, thanks. And I come at this from having been a judge for 18 years in Durham, and especially specializing in juvenile court. And to see the problems, the mental health issues, the behavioral issues that bring kids into the delinquency system, you know, the number one thing we can do is get them behavioral help, psychiatric help. And that's where we need to invest a lot of money to put kids in detention because of a developmental disability, for substance abuse, for behavioral issues. We cannot put them on waiting lists. We cannot keep them locked up because they deserve our attention, and we need to fund it. We need to put more money into DPS to get these kids help, because if we do it right early on, we're going to stop the crescendo of the school to prison pipeline and paying for them through the criminal justice system. So I think this has to be one of our top priorities, to get North Carolina out of the bottom of 42nd up to the top in how we're helping our kids, even if it's specialty courts for substance abuse, for mental health issues, to really do all we can to support these families and support our children.
Thank you so much, Representative Maury. What about you? I see you've got your hand up, Representative Cunningham.
Thank you, Rose. There are three things: access to care, which would work for prevention, early intervention for the trauma, and also mental health parity. We still have an issue with mental health parity and costs. Even though you may have an insurance card, that doesn't necessarily mean that you're going to receive equitable costs when you go to a mental health professional. The access to mental health professionals is in great demand. It was already in a great demand. And we know in the eastern part of the state, which I'm not from, but I'm very abreast, that in the eastern part of the state, there's a limitation on the access to qualified for psychiatrists, psychologists, and other healthcare professionals, such as nurse practitioners. And that's another issue. If we would allow nurses to practice at their highest scope of practice, that would give more access to those places in the rural areas in the state of North Carolina. But we also know that lots of parents are experiencing hardship and struggle during this time. And a whole lot of them was experiencing it prior to this time of COVID. That's going to be a continuation. So we have to look at that we are doing preventative services and early intervention, not just for children, but for adults as well. Because my son is an adult that continues to receive services frequently under the LME and the MCO to keep him stable and a functional, prosperous, productive member of society. So we've got to do more in that aspect. Thank you.
Representative Cunningham, you were like hitting that 90-second mark. I really appreciate it. I don't know if you all can hear my little phone pinging through my speaker here. You know, that does bring up an issue, Representative Cunningham. There's some questions here about the SAVE Act, about what can the legislature do to help promote the creation of new practitioners? Is it the SAVE Act? Is it something else? Does anyone have any thoughts around that? And just as a reminder for folks, the SAVE Act was a bill that would allow for advanced practice RNs such as clinical nurse specialists, nurse practitioners, et cetera, to to not have to have physician supervision so that they can practice more independently, open practices in rural parts of the state, et cetera. So Representative Cunningham, I see you have your hand up.
Thank you so much, Rose. Let me go back to the ACA. When the ACA was brought about, which is the Affordable Care Act, inside of it was part of it was to allow all of the advanced nurses practices to practice at their highest scope of practice. Why did they do that? The reason they did that is because we don't produce enough physicians. It takes 8 to 10 years to get a physician out. In order to increase access, you would allow them to practice at the highest scope of level of their profession. Well, also it's a money thing tied to it. I'm gonna be straight about that. It's a money thing tied to being up under a physician. Some counties, rural areas have a nurse anesthetist that work inside of that hospital because they can't get a permanent anesthesiologist to work in that area, but they still have to function under the direction of a physician, but they may not even see that physician. They may talk to him twice a year or send their check or whatever twice a year, and that's that. They're still practicing, but we need to do that because it would increase the access in those rural areas where they lack enough primary care physicians and other physicians to provide those services. That would definitely improve the healthcare outcomes in the state of North Carolina.
I know that the SAVE Act was introduced in the last legislative session. Do we know if it's going to be introduced again? And where do folks stand on that? I mean, we've heard from Representative Hurley and Representative Cunningham, or where are people on this particular issue?
You want me to check?
Well, Senator Bergen has raised his hand.
I'll talk about it just a minute. I think we're going to be looking at all scope of practice, and we will be doing something either through the COVID bill or through individual legislation to deal with it. I think there's still 3 counties in North Carolina that don't have a doctor in them right now. And I don't know how many counties don't have a psychiatrist. I know from talking to Cody, we needed to hire a number of psychiatrists about a year and a half ago, and it takes forever to try to get psychiatrists. I've been to all of our mental health hospitals and a lot of the other facilities that deal with mental health and treatment centers and opioid centers and folks, we need people in those doctors, nurses, psychiatrists, counselors. We need all of those folks, and we're going to have a real situation coming up with nurses. A lot of nurses are going to be leaving the nursing profession because of COVID. I've talked to a number of them. They're either going to go ahead and retire or do something. And my time's up, but I'll talk about community colleges and what I've asked them to do later.
Oh, community colleges, that's a great resource that we have as a state, and we have a terrific community college system. Along the lines of funding the mental health system and funding Medicaid, there's been a number of questions here about single stream funding. We saw significant cuts to single stream funding to the LME MCOs. That's the state funding that, I need to stop. The single stream funding is the way that the state funds services for folks who don't have any other form of reimbursement in the LME MCO system. We've seen some big cuts over to that in the system, and I think this year that perfect storm showed how that single stream funding really undermined LME MCO's ability to get help to people. What's the prospect for single stream funding this year? Does anyone have any thoughts on that? I mean, I know Senator Bergen, did you say you're in appropriations?
Yes, ma'am.
So, has there been any conversation amongst your colleagues about what will happen to the single stream funding this year?
Yes, ma'am. In fact, we've got a meeting next week where we're taking each one of these topics and going through and looking at money. We're waiting for money reports right now. That's the big thing. Until we know the total amount of budget we're going to be able to, the budget starts in the Senate this year. So we will be working on it and then sending it over to our friends in the House for them to work on it. So as soon as we get those numbers, we're going to have a great idea. But I want to deal with a lot of these things. I want to deal with single stream funding, more money for mental health, more money for innovation waivers, more money for these targeted programs we want to do to deal with the folks. I still want us to move forward on the association health plans. We've been waiting on that. We feel like 150 to 200,000 people could pick up insurance through association health plans. So we're really working on a lot of different ideas that I think people are going to be impressed with. I think people are going to say these are good things and they're helpful things, but at the same time, we maintain our financial integrity. One of the reasons North Carolina is going to come back after the pandemic faster than anybody else is because of the way we went into it. Financially strong with money. We were able to spend billions of dollars that other states couldn't spend because we had a rainy day fund, a very good rainy day fund. And folks, I think after the first quarter of this year, you're going to see a huge change in what's going on. I think with the warm weather, the people that are being vaccinated, the herd immunity, I think the perfect storm that took us into this could also bring us out of it.
Mm-hmm. Thank you for that. Anyone else have anything to Representative Cunningham?
Thank you, Rose. I would speak on the single stream funding. We did have to put some additional money a couple of cycles ago back into the single stream funding. A lot of people don't know what the single stream funding does, but it covers those people that are uncompensated care that the LMEs and the MCOs have to oversee. But on the single stream funding, even when the COVID came about, we had to put additional monies out of the COVID funding that came down from the federal. Initially, we had to put more money out of that to MCOs and LMEs because we got so many people that do not have any type of healthcare coverage, and they're filling our hospitals in the emergency rooms while there's a pandemic going on. So we're going to have to relook at single stream funding as ongoing, but not just during COVID. But I can see the expectation that it's going to be a significant need if we don't figure out a way to ensure those additional people that are still filling our emergency rooms that lack any type of healthcare coverage. Thank you.
Well, you folks are now getting the opportunity to meet my mental health professional here. She's my amateur mental health professional, but she's been very helpful during the pandemic. She may be appearing. She just came back from her walk.
Great service dog.
Exactly. Speaking of training, there's a question that we received during the registration period to see what about training for law enforcement professionals. This is a real issue, I think, for folks around IVC, handling folks with mental health disabilities. I see Representative Hurley. Are there any thoughts around in the legislature around addressing this issue?
I think that the crisis intervention teams is one of the greatest things that had been started. And that started in 1987 when a mother had called about her son having problems, and they came and he was killed. He was shot because they didn't understand that it was a mental situation. And I think that not only the law enforcement people, but the hospital personnel, all of us need to know when you can determine against a criminal, whether it's a criminal act or whether it's somebody with a crisis, and the crisis intervention teams, as well as the crisis centers, have taken a big load off of our hospitals. And I definitely think we need to do more that way. And I know local communities are really involved, and our community colleges are really involved in this. And I think that is understanding what's going on for all of us, communication and understanding the behavior, I think helps all of us to know what is going on and be able to help those who are in need. And I'm certainly for helping, in any way I can.
I saw that Representative Maury put her hand up on this question.
Yeah, thanks, Rose. One thing I'd remind people that Governor Cooper formed a task force on racial justice, racial equity in the criminal justice system. And, you know, we had 7 months of meetings, 40 meetings, public hearings. And one of the big focuses was how do law enforcement address 911 calls? You know, and I agree with Representative Hurley, the crisis intervention teams. Charlotte is doing a great thing with mobile crisis units, but it takes the entire system to look. How do we deal with the racial equities when we incarcerate 6 times as many people of color as we do whites, when we stop 4 times as many people of color for marijuana use than we do whites, and there's equal use across the board? We have to look at these racial equities along with awareness and education on mental health disparities. Our system used to have drug courts, substance abuse courts, all that was cut by the state. We have to come back and look, how do we not criminalize these issues, but get the treatment for it? But I'm proud of this report. I think it's a great report. It's about systemic racism that we have to address and what we have to do on our mental health issues. And we cannot incarcerate people out of this.
Thank you so much, Representative Maury. And Representative Cunningham, I saw you had your hand up.
Thank you, Rose. One of the things I wanted to let everybody know that 17% of the people that are incarcerated in our correctional facilities, 17% have a mental health diagnosis. So we're starting to house them in institutions, prisons, instead of providing them the care that they need outside of the prison walls. You know, when you start thinking about crisis intervention training, it takes about 40 hours a week for the law enforcement officer to get trained. Mental health first aid doesn't take that long. So we, under the Criminal Justice Reform and Law Enforcement Community Engagement Committee that was created by the Speaker of the House, we worked on that committee to look at some of the things that we need to look at as far as law enforcement and the community. It was the chokehold was one of the ones that came out as a recommendation. If I'll see that move, I don't know. But crisis intervention training for all of our officers in law enforcement is a need. It's just that finding the money to invest in them to take that 40 hours and get that crisis intervention training. Most people, when they have a crisis with the mental health, they don't know who to pick up the phone and call. They just call the CMPD or they just call 911 and say, I got an issue going on. But actually what they can do is call and say, I request a crisis intervention team to show up instead of having a regular officer to show up, because they're specially trained on how to interact. The last thing that I'll say, we're expecting police officers to do 5 and 6 jobs. We're expecting them to be our social workers. We're expecting them to do medical things that they're not trained to do. So what we did in Mecklenburg County, we now have mental health professionals that go out with our police officers. There's a program that started in Ohio called the Cahoots program. They've been running that program for years that decreased the interaction and the fatalities for over 45%. And that's what we need to be looking forward to, is how do we manage inside of these communities those behaviors and putting the proper people there to interact with them, assess them, and move them over to the services that they need.
I let you go on a little longer about that, Representative Cunningham, because that sounds super interesting. I just texted one of my reporters and I said, story for you. So thanks for letting us know about that. You know, does anyone else have thoughts about this? Or I can move into a related question. And I love the idea that, you know, it seems to me like there's an opportunity for the mental health community to educate their constituents about when someone calls the police to ask for the crisis intervention team. That's a terrific suggestion, Representative Cunningham. Thank you so much. You know, moving on to something related, you know, we've seen increased attention to healthcare in jails this year and the state prisons, in part because of what COVID has done in those places. But, you know, in past years, jail deaths and suicides have been an issue. And there are some rules from DHHS to prevent them, but you know, how well are they enforced? And is there something that the legislature, what can legislators do to help the jail and prison systems to enact these policies more consistently across the state? Senator Bergen, you have your hand up.
Yes, I've been serving for last term and then again on this term on the Select Committee on Prisons. And so we've been visiting prisons. I've been in local jails. I've been to, it's Central Prison. I've walked out on death row, visiting with folks. And I think a lot of the problem is we are not taking the services into the prisons as much as we need to. I've talked to Cody about this, and we're trying to work out a way where we get into the prisons, get into the jails. My sheriff, Wayne Coates in Harnett County, estimates that about 50% of the folks that he has incarcerated have some kind of mental health need. I'm not going to say they have a full-blown diagnosis, but they have a mental health need. So we need to be treating those folks there. I'm also a big proponent of long-term injectables for mental health, and we're going to be working on something to allow pharmacists and others to do the long-term injectables. I hear all the time that people get out of a facility and then they quit taking their medicine because they don't like the way it makes them feel, or while they're on their medicine, they're fine, so they don't think they need their medicine. I talked to someone just this week that his mother-in-law has been in and out of mental health facilities because she will not take her medicine. So that's something that I'm really looking into and want to help do it. But I want to get services into the jails so we're not just running a turnstile of people getting in, getting out, getting in, getting out. We need people to be able to stay home, hold a job, function in their community, and have a successful and profitable life.
Thank you so much, Senator Bergen.
I'm getting better.
You were sort of right on. You were right on there. So is anyone else, Representative Cunningham? I see you have some thoughts to share.
Yeah, thank you. On the jails and the prisons, I'll stay on the jails. One of the things that we know in the last couple of years, there's been a significant increase inside of the jails under the sheriff, not necessarily under the police department, but under the sheriffs that have overdosed and committed suicide. And those numbers have been significantly increasing. And I'm curious and looking at putting forth some legislation that we do a study and start to collect the data. We need to know why these people are dying inside of the jails. And we must remember, these people have not, in most cases, been convicted. They're in a holding space. We had a 17-year-old to die a couple of months in the jail in Mecklenburg County. He was on suicide watch. Now, how he died, I don't know yet. And I think the family has already reached out to look at what is going to be available to them. And you want to know if they under suicide watch, is the protocol being followed inside of the jail so that you won't have these incidents occurring. And we've had a person overdose in the jail. And I get calls from all over places talking about their loved one is going to jail instead of going to a substance use treatment facility because there's a backup in getting a bed of 45 to 60 days. So we've got a lot of issues in that aspect. And I think we need to take a good hard look at what's going and how we can address it before it gets to that point. Thank you.
Again, this brings up for me something that I've thought about for many years and wrote about more than a decade ago, is the profound lack of housing opportunities for people with mental health disabilities. Cody talked about the TCLI program, which has been used to fulfill our obligations under the Olmstead decision from the Supreme Court. But I think the time frame for that is coming to a close. Do folks have any thoughts about helping to create some resources or legislation that could encourage the creation of housing for people with mental health disabilities? Does anyone have any thoughts about that? Senator Bergen.
if no one else was, in fact, I was at a meeting in Lee County, not before last, with the commissioners and with the city council folks, and they are working on doing a center for the homeless, but they know that the majority of the folks that are homeless have some kind of mental health issue. So I want to look at ways where the state can partner with the local municipalities and counties to come up with options, and let them kind of guide the way they want it to go. But let's make sure that we can fund it. You know, if you get somebody in a secure environment where they're off the street, where you can assess them and start treatment and get them on proper medication, I think we can do this much faster. One other thing Cody was talking about, I always say it's $1,300 to $1,400 a day to keep someone in one of our 3 mental health hospitals. On any given day, there's 100 people ready to be discharged, but no place for them to go.
Right.
And at the same time, there's about 100 people in emergency rooms waiting to go into those mental health hospitals, but we can't get them in there. If you run the math on those, it's over $200 million that we have that we could spend on folks it's a housing issue more than it is a treatment issue. So I want to try to deal with the logistics of that.
Mm-hmm. Yeah, that it's very true. I think that one of the things that often gets lost is that the costs get calculated, but sometimes the potential savings don't get calculated as robustly. And so I think that's a really important insight, Senator Bergen. Does anyone else have thoughts about this before I move on? Go ahead, Representative Hurley.
I think I have, when I was on Health and Human Services, a lot of the people who have mental health problems do not want to go out on their own into their own housing. They, I think, enjoy a group setting rather than that. So we need, I think, more places and I know elder parents are passing away and their children, have no place to go, and they haven't planned for it lots of times. And there's just a big need here that we do need to look at. And I know there's been studies, there's been situations, but I know Representative Cunningham has maybe some insight on this. Thank you.
Well, in other words, what's most important is for folks to have choices about where they can go, whether it's to a group home setting or maybe with just a roommate, or if they want to be independent. Representative Cunningham, looks like you have some thoughts.
Yes, I would say that lots of these individuals want to be productive members of society, and they want to be treated just like a person that does not have a mental health issue or a substance use issue. So we do have some independent housing with wraparound services so that these individuals can be successful with, once they become adults, they can move on their own, they can get the assistance to keep their bills paid, keep food in the house, and there are vouchers that help them set their homes up. So there are some options there, and they do assess them and see if they qualify to a level of independence that they can function with minimal assist from the LME and the MCO. But they want to be just like normal, treated normal, just like us. And as they become adults, they want to be a man and they want to be a woman and have the same opportunity to enjoy what we have the opportunity to enjoy. So we need to look at doing more of it. And even for the homeless and the veterans, a large majority of them have some mental health or have some PTS going on. So there's more that we can do in that community, but it's going to take a lot to move forward because we've already been in a housing shortage in the state of North Carolina for years. We can't build fast enough and the land is running out.
I think that's if folks are looking for a model, one of our neighboring states, Tennessee, has done a terrific job in creating housing for folks with mental health disabilities. And, that's a great place to look. It's a state that looks a lot like us, has a similar cultural background as North Carolina. And there's a lot of resources that they developed in that state. If no one else is interested in responding, then I'm going to move on to something that's similarly related, but that is coming up, and it's coming up also in our reporting. And that's the issue of what's happening in the state with involuntary commitments and also the transporting of folks during involuntary commitment. You know, what we found in our reporting is that the vast majority of the time, folks who are being transported from an emergency department where they're waiting for a psychiatric bed, when they're going to that psychiatric bed, they end up in handcuffs, something that's a deeply traumatizing experience for these folks. You know, is there some way to perhaps change the policy? Is there some way for the legislature to get involved in helping this change so that this traumatizing event is not going to be visited on folks who are also already vulnerable? Representative Maury, looks like you've unmuted yourself.
Rose, it is a huge issue. It's not only when they're being transported, it's when they're being brought into court. I would preside over a lot of these IVC hearings, and not just handcuffed, they're shackled. And for the family members to see their loved ones sitting in court on a mental health issue and then a commitment to further traumatize them with the shackling, I think we need to keep in mind safety, but there's often ways to do this without the extraordinary means of shackling. And that we should look into that, and all the least restrictive means are necessary, and to do as little transporting as needed. We're doing a lot of things virtually now. We need to do some of these IVCs more virtual, but also the revolving door, that people do get a commitment and then they're out within 3 or 10 days because of space issues. So there's a lot to be done. I hope we look into that.
Mm-hmm.
Rose?
Anyway, Representative Reeves, he hasn't had a chance to say much, so I'm gonna give him a chance.
Thank you, Rose. And I'll try to be brief. I just really wanted to piggyback on what Representative Maury was saying. One is an issue about making sure that we have the facilities to take care of them once they're in, and that'll help out a lot. But especially on the shackling issue, I've witnessed the same things that she has. And I actually noted Sheriff Blackwood brought up the point I was going to bring up, is that this is another area where we can use specialized teams, you know, people who are actually trained in the transport, trained in the handling of folks in these situations, because obviously they're pretty extreme situations. And if we had people who were ready to take care of these situations, you'd have less need of the shackling, because it is traumatizing. I think that, you know, if you've never either been in handcuffs or had a family member in handcuffs or any of that sort, that's traumatizing for a person that is completely without any type of mental health issues. Mm-hmm. And so, you know, then you put somebody who's already in a vulnerable state in handcuffs, not because they've done something especially wrong, but because they just are having problems that we need to help them address. It just makes things worse. And then, just like Representative Maury said, then you turn right around and put them right back out of the facility that they need to get their help and care from, and they never get a chance to recover. So I completely agree that increasing housing, getting more specialized teams help solve that problem, and it helps make everybody else safe.
Terrific, thank you very much. And Senator Bergen, you were looking to weigh in.
I was just going to say, a couple of years ago, I got a call from someone about a child at an emergency room that was handcuffed to the bed and had been there 3 days, handcuffed to a gurney. And, you know, and we don't need to do that. We don't need to do things like that. Part of it is we need to make sure that we're not taking those folks to an emergency room. We need to get them to a facility. I was also at a facility in Durham, and their policy is the police actually can take folks straight to that facility and drop them off. And we were talking about the restraint. They said that the second they see them, they remove, you know, the handcuffs, and they're never restrained like that again. They deal with it other ways. We just need to train our folks. You know, I don't want somebody getting injured trying to deal with someone. You know, that's not a good solution. But there is training. There are ways. There are medications. There's things that we can do. But taking somebody that's having a mental episode and restraining them is never good in that situation.
And I see that Representative Cunningham has got some thoughts on this.
Thank you, Rose. I think one of the things that we have to think about as parents or loved ones or family members is seeing the person in already a mental health crisis and adding that additional that you've got to see them in handcuffs when it's just a behavior or maybe a mental issue crisis going on. I think that, you know, we've got to invest more in the proper training. I know for me, I have seen my son that way. I know for me, I've seen him be under suicide watch within a facility. But you know what they do? If they can take them straight to the hospital, that's the best option. But in some cases, they may not be able to take them to the hospital because it's not available space. During COVID, we've had people laying on the floors inside of triage facilities. We've had them lined up outside waiting to get in because they need emergency services for their mental health issue that's going on. We're in a crisis, but we've got to invest in it going forward because we were already in crisis before then. Can you imagine if your son or your daughter is going through a crisis and the police pick them up and take them downtown and they're suicidal and they take all of their clothes? They have no clothes when they put them inside of that jail cell, and that's for safety. But you don't want that when you have an option to get emergency treatment inside of a behavioral health facility, which right now is backed up, and we don't have enough transitional beds for these people to wait to get the services that they need. We're in a sad predicament right now.
Mhm. You know, the thought occurs to me as we're talking about this, that the state does not have, the state has limited funding for mental health courts. And it ends up being left a lot of time to district courts to find that funding for the mental health courts. You know, what can, is there perhaps a legislative remedy for this, whether it's financial or more of a mandate? Like, does anyone have any thoughts about that? All right, we don't have any thoughts. Or Representative Hurley, go ahead.
Well, I do know that we had drug court and we had different things, but it costs more because you get the administrative people too, and it does cost more when they have the specialized courts. But ours decided on family court rather than drug court. And I think you have to make decisions and you have to see how many courts you're going to have and use your money wisely. And I think when you're budgeting, I think the county can help. And I think that, of course, the state, there again, it's education is 58% of our budget. We have only some like 4 dimes left for the other agencies. So we're going to have to figure out a way to help in the needs that are number one here, because they can't help themselves. Those that have mental health issues, they cannot help themselves. They've got to have help from others. So we do need to look about this.
Representative Moore, you had your hand up.
Well, in the courts or therapeutic courts, you don't want people in the courts if they don't need to be there. I mean, the judges are encouragers. You don't want the response to someone who's violated by locking them up. But unless you have the foundation of the treatment, you know, the courts can't do much. And so when we have defunded treatment for substance abuse or mental health, just having a mental health court without that assistance isn't a lot of help.
Mm-hmm. Mm-hmm. And Representative Reeves, you put your hand up there for a moment.
I did, and as always, Representative Moore said it better than what I was getting ready to say, but that is absolutely correct. I mean, it's got to be a holistic approach, but I can tell you again, as somebody who practices in the court system, I am a big believer in the specialized courts. I think one of the courts that pops into my mind right now is my main practice counties are actually in Senator Bergen's districts. And so, you know, he and I would always have a chance to interact back when I used to represent Lee County, but I still work there, so I care a lot about that. So with that being said, one of the courts we had was Veterans Court. It was the baby, and then Senator Bergen was very instrumental in helping us get that. My past elected DA really cared about this court, and it's a perfect example of why these courts work when you have all the surrounding systems there. The good things that you have with Veterans Court is all these veterans had, veterans hospitals they could go to, and they had treatment that they could get through government. And so watching what that would do, we've got one judge in particular that I wish she could go around the state and talk about it, because she's done that court and she just talks about, I remember I had a client who had a simple driving while license revoked. But he's a veteran, they put him right in that court, and your immediate thought is, what's the big deal? It's a traffic ticket, you ought to be able to do it. But they uncovered so many other issues he was having, and they were able to help him, and they kept him from being back in our court system. So I'm a strong believer in those courts. I hope legislatures and counties get together to make those happen.
That's a really great point. Senator Bergen, you put your
I
finger
was just
there.
going to, and look, Robert's a dear friend. I love him, and I appreciate you bringing that up, Robert. He, Harney County started the first Veterans Court in North Carolina, and it's been just tremendously successful. We have very, very few people that end up back in the legal system because of the folks that are running it, and they're military, they understand, they know where to go get benefits. I wish we could do that for every person that goes into the court system, provide those kind of services. And, that ought to be our goal, is to treat everybody like that so that we get them to the proper services.
Mm-hmm. Thank you for all those. That was a great conversation. One of the questions that came up, and I think this is really an interesting question. What would be helpful for you folks as legislators to know, as in your role as legislators? And like what can be done? I mean, other than, there's 6 of you here, there's 170 of you total. What can be done to help educate legislators about these issues? Representative Cunningham.
Thank you, Rose. I think exactly what you all are doing this morning is bringing people together, putting the issues out in front of the community, because that's where they start. And if we can hear their voices mean more than anything. They can pick up the phone, they can call us. And I get a lot of calls, believe it or not, from across the state on issues with the Department of Health and Human Services, developmental disabilities, substance use. I get those calls, and I probably get them because I'm a nurse, but by no means do I have an expertise. By no means do I know everything, but there are people that we can touch and reach out, such as NAMI, Mental Health America, as well as numerous other organizations. Even our hospitals have a plethora of knowledge. We have a behavioral health hospital in Mecklenburg County. I can pick up that phone and get stats and talk to them and say, what's going on at this hospital at behavioral health? And that's what we have the capability of doing. But we're here to hear from you, hear your voices, and that's the value. It's not us that value, reverse it, because your voices matter the most to us.
What's the most effective way to reach you? Is it a phone call? Is it showing up at your office? What is it?
Yes, you can make a phone call to my office. You can send an email, but emails sometimes can come in volumes, and I may not get to them as fast, but people call me at home too. My number is available. You call me at home, I'm gonna pick it up, and you tell me what the issue is, and I'm gonna get on the phone after that. And you can call the office, and we have one office person. It's not like Congress. We have one legislative assistant. So that one person works closely with us to see that we handle things, or that we get back to the people that we need to take care of things. Thank you.
Thank you. Representative Hurley, you had your hand up, and then Representative Reeves and Representative Morey.
Yes, I feel like as legislators, maybe we could have a mental health caucus. Just an idea.
That would be fascinating. I think I've seen a couple of folks turning on there and giving big thumbs ups. I think that meant the social workers are doing that. So Representative Reeves.
I would say the most effective legislation that ever gets passed in that chamber comes from you. It comes from the people, it comes from our constituents. The most effective thing that you can do to help us do these things is just what Representative Cunningham was saying, except I'm not going to go as far as call me at home. Appreciate you, but I'm available 16 hours a day. So, but what I would say in all seriousness is individualized stories have an amazing effect. You'd be shocked how many times just the right story that talking to the right legislator gets something moving and gets a movement moving. I know when my first bills passed, it came from an individual story. But with that being said, the biggest thing you can do is walk into the office of your legislator with no biases. Don't look and say because they're this party or they're that party or because they've got this background that they already have an opinion on your subject matter. You walk in there and pretend that you are talking to a blank slate, because the best legislators we have are blank slates. They do not bring their individual biases, concerns, or problems or issues and background in there. They want to hear from you. And if you give them that information and give them information believing that they're going to listen and they're going to talk to you and they're going to interact, you can really come up with some great solutions.
Mm-hmm.
And thirdly, I would say it's always great to come up with solutions that don't cost a whole lot of money. But and I say that jokingly, but in all seriousness, you'd be surprised how many times that that we're an impediment as a legislature to actually counties and cities doing things. Sometimes counties and cities have monies and have resources and they're ready to go, but we've done something to stop it. And so, help us out, but just come to us because we're not experts. Representative Cunningham and modest, she actually is a brilliant person in this field, in this area with health and human services. But, a lot of us are just like me. I don't know, and I need you to tell me. So thank you.
Mm-hmm. And in the chat, someone said here, Representative Hurley for the win. Woo-hoo. There's a lot of support for that idea, Representative Hurley. Representative Maury, any thoughts about this? I saw you had your hand up earlier.
Thanks. And Representative Hurley, I'll sign up. I think absolutely right.
Well, I'll need a co-chair.
I think this is the most pressing problem we have, especially in light of COVID. And I think what Representative Reeves said, a story. And I had a story from a parent of two little girls who are virtual schooling. And her 13-year-old said, I can't do my math. And the mother said, why? And said, it makes me anxious. Well, what happens? Well, I get depressed. Well, what then? Well, I think of suicide. And what all of us are going through with mental health stresses right now with COVID. And, it's overwhelming. It's not going to just end with the vaccines ending. Mm-hmm. They estimate 1 in 5 people who have experienced COVID will suffer from mental illness disorder. UNC is opening up a post-COVID treatment center in Chapel Hill. But I think, all of you that work in mental health, we as legislators have to prioritize this for everyone who's been in social isolation, for how our kids re-enter, schools. The work's cut out for us, and I just honor everybody's service. Thank you.
I think Senator Bergen, sorry. You have a thought.
I've been asked this question about 3 times this week about how to approach legislators. And I tell folks, you got to develop a personal relationship. Everybody that's on this call either knows somebody or personally knows one of us elected officials. And we need, you need to develop that. You need to talk to us, not just when something's wrong, but all the other times. And please don't bring us books of material to read. We get, every day I end up with a stack of 4 or 5 inches, and we get about 500 emails a day. So, I tell folks, come in. I'm a Baptist. I say I like 3-point sermons, and I like 3 requests. Bring me 3 requests at a time. I'll work on those 3 things, and then you can bring me some more. But keep it succinct, keep it very focused, but develop those personal relationship. And the time to do it's not when there's a catastrophe. The time to do it is an ongoing time.
Mm-hmm. As Senator Bergen, it's not just the Baptists. I was educated and ruined by Jesuits who said the same thing. A good sermon is a strong beginning, a strong end, and no more than 3 points in between, and it all needs to be short. So, speaking of keeping things short, we are about 2 minutes shy of the absolute drop dead time. So I've been asked by the organizers to take the opportunity to thank everyone, to thank these legislators. Let's give them all a round of applause, a thank you for spending some time with us this morning and, allowing themselves to be put on the spot and to answer these questions honestly and thoroughly. I really appreciate everyone's time and honesty. And the organizers have asked me to thank everyone for attending, and we'll be seeing you during the legislative session. We'll be seeing you in the coming years at the Legislative Mental Health Breakfast, but I would love to see us back next year. No COVID, people addressing their PTSD, people gathering together in one place, able to support one another as we start this, long recovery from this crazy year. So thank you so much to everybody for joining us today. And with that, I think we'll be signing off. So thank you very much.
Oh, Rose, I think I've got a couple things to do.
Senator Woodard, sorry, you're the closing act. Okay.
Yes, thank you. Yeah, don't take away all my jobs from me. But Rose, thank you very much for always an excellent job facilitating 4, 5, 6 politicians. We're a tough crowd to manage, and you do it well. And I want to be sure to thank Senator Bergen, Representative Cunningham, Representative Hurley, Representative Morey, and Representative Reeves for a great conversation today. And thank all of you. While the pandemic forced us to meet virtually, our commitment to raising awareness around the issues of COVID-19, racial inequality, and social justice on mental health really just moved us forward today and moves us ahead in 2021. Our event today has been made possible because of the hard work of a lot of volunteers, service providers who were here, my fellow elected officials, and our sponsors. And thanks to all of our speakers. This is always such a great panel. We learned so much, a great event, learned so much great information. And thanks to all of you who registered and attended, almost 700 people who signed up and joined us at some point during the day. So just take the messages and the things you learned back into your community, and let's put them to work in this new year. At this point in our previous face-to-face events, I usually say travel home safely and see you next year. This year, I'm going to say stay safe and don't forget your 3 W's and wear your mask, whether it's from North Carolina Health News or not. But always remember your 3 W's. And remember to mark February 26th, 2022 on your calendar. February 26th, 2022. Let's hope that we're back at the Friday Center enjoying breakfast and each other's company when we convene for the 44th Legislative Mental Health Breakfast. And thanks again for attending. Take care of yourself and take care of each other. Bye.